Hi, good morning. Let's focus this in here. It's Brad, and this is part two of my knee replacement journey. Today is August 10th. Very warm out, so I'm sweating. I apologize. I just got in the car and it's very humid. So, as I said before, I'm doing a series of videos. I've seen people do these on YouTube as a way to help them through the surgery and their progress and watch their progress and also help others that may be thinking about having surgery. So I hope if one person watches this, then I'll feel as though I have done my job. I want to correct something that I said previously last week about my cystoscopy. A cystoscopy is a procedure that they do to go through and look at your bladder through a scope. And I said that people, men, their bladder enlarges. That's not the truth. It's their prostate enlarges and breaks tiny blood vessels, which in turn creates microscopic blood in the bladder. So a cystoscopy is often done as a precautionary measure to make sure you don't have something more seriously wrong, like bladder cancer or something like that. So that's when I had my last surgery a few years ago and wound up in the ICU, and that's on the other video. A few days ago, I went to see my primary care physician, Dr. Abraham, George Abraham, who I think is the best, and did a pre-testing, surgical pre-testing. That involved height, weight, check my ears, my nose, my throat. They did a swab in my nose for MRSA, not for COVID. That's coming up next week. EKG, everything's fine. Of course, overweight, and extremely nervous, which I have something called the white coat syndrome, which is when I get nervous going into a doctor's office. I can't help it. Plus, I do have anxiety, an anxiety disorder that I deal with daily, under control for the most part, but I do still get anxious and it's out of control at times. So let's see. The VNA came down about 10 days ago, and her name was Kelsey. Very nice girl. And I said to her, I've got 10 steps up my deck. How am I going to get up the deck? Oh, you'll do it. You'll do it. You'll be fine. I'm like, I'm by myself, which and my brother is downstairs, but he works a lot of hours and I don't want to bother him. Oh, that's fine. That's fine. That's fine. So I went into my apartment and we did some up and down the stairs. She's like, go into the bathtub, get out of the bathtub, go in bed, get out of bed. And she wants to just see, I guess, my upper body strength, which she said I have great upper body strength, which is important and very helpful. She said to me, your toilet is low, so I recommend you get a toilet seat because your toilet is low. And if you get a toilet seat or a toilet commode, what I got is it's handles and then the hole for the commode, and you put that right over your toilet, so it raises me up a good 4 or 5 inches. So I got that. She said get a bathroom toilet, a shower seat, but I think it's called a transporter. Sorry, I'm playing with something here. I think it's called a transporter, where you have two legs in the tub, then you have the bathtub wall, and then two legs out of the tub. And of course, have a shower thingy, which I have a wand that I can shower. So my understanding that you won't be showering for a few days. Once again, everybody's different. They don't want you to get the incision wet while it's healing. So I got all that, and let's see. I have to go into a class. It's an in-house class, although I'm told they're starting to do them online in Zoom. Wish I could do that, but maybe I'll call and ask. But I do have that class coming up where you're going to go and they're going to teach you about the surgery, and I don't need that. I mean, I've looked it up online for years now because I knew this day was coming. But I suppose it's good to, see what they have to say. My VNA said, get 4 bottles of ice water, the Poland Springs water, put those in the freezer. because you will have an ice machine, and that ice machine needs ice or cold water. So you just use the cold water bottles, and you can recycle them and not, you know, use ice. I guess it's maybe a little bit more convenient. I don't mind ice, but whatever she wants to do. Um, let's see, what else? I have a follow-up visit. Um, 1 month after my surgery, the VNA nurse, physical therapist will be coming down to my house, I think the day after surgery, and will start me on some exercises and probably check my wound. And, I also have a home health aide coming, which was hard to get that. Not sure if it's insurance wise or what, but my primary care doctor, Dr. George Abraham, was able to get that. Am going for COVID testing next week. He also changed that location. I was going to Reliant in the Auburn Mall, um, but that's been stopped because he said Reliant is very backed up and St. Vincent Hospital is not that backed up, maybe a couple of days versus 7 or 8 days. And that's all set. So I've got a whole list of appointments coming up. And I've got another thing I want to talk about is what the VNA said is think about your pets. Also, your meals. It's 2020, and today we've got these apps on our phone, Grubhub, Uber Eats, it's the other one. So many where, you want to get something to be delivered. It's nice. A home health aide can do that as well, but those apps are pretty cool, and you can get the food coming right to you. The home health aide, I have an apartment, and the home health aide will, you know, make the bed, clean the bathroom, vacuum the floors, wash the floors, etc., etc. So um, that will all be taken care of. And God, it's so hot today. It's humid. It's like 76 degrees, but humidity is gross. Um, so that's basically it. And I'll do another video next week. Again, I'm doing this video as a way to keep my progress and my journey documented, and also for those that may be considering this, what they're going through, what's going to be happening, etc., etc. So that's it for this video. This is part 2 of my knee replacement journey. Thank you all for watching. 15, 16 days, wait, 15 days. It's coming. So thank you very much and have a good day.